So I had this patient, right? And she had this kind of, rotation through the T10, T11 area, to say the least. And when we've got a rotation through one side, the convexity gets expanded. It starts to spread apart. And these ribs here will start to kind of flare outwards. By comparison, the opposite side, the concavity side, those ribs will start to come together. And they are, by comparison, again, compressed. It's understandable. It makes the most amount of sense that we would get some pain usually in this area, kind of shooting off like that as we strain, as we take too far the connective tissues within that region. However, the opposite side does something a little bit differently, and it starts to build some of these complex patterns we often talk about. So what you'll notice is this rotation start to happen, this side bend rotation complexity start to happen, and it goes through the ribs. So if we're looking at these ribs in the front, we've again got our expanded side, so we've mirror imaged this expanded side over here and our compressed side over here on the left. With those ribs coming down and rotating, what they can often do is come up and under a little bit. Remember that it's a cartilaginous joint largely here in the front, a wide area of cartilage in that 8, 9, 10 area, and of course throughout the rest of the ribcage too, but in a big way through here. So it's very, very possible for this to get all folded up, especially if we give it time and pressure. And as that comes in and under, it's as if these 2 points in the rib were coming together. And with that, as that really one side comes towards the other, we can see that the respiratory diaphragm, which is certainly a breathing muscle and located right about here, will be shortened up. It'll be shortened up in this direction, as if it were no longer properly tensioned, and it will be slackened by this shortening. Now, an interesting thing happens again. It's all interesting, honestly, every single part of it. But this is very interesting because it turns out the respiratory diaphragm, as it moves down, as it contracts, and when it does so properly, it actually puts a lot of pressure down on the viscera, the guts. And those viscera, whether it's the large intestine, the small intestine, or all the way down to the colon, which is just another way of saying large intestine, but all of that actually provides counterbalance against the diaphragm's pressure. It resists its complete collapse, and therefore it props it up. And in a way, it is part of the postural system. So as this area rotates through here, as the guts are no longer now able to properly resist, as they fail to do so, we actually also get a flexion that starts to come through this area. It starts to fold down in addition to its side bending. And when it does this, it starts to build into the problem. It starts to further compress down on this area in this angle. And so what we can end up with is a folded, pressured spine, one that no longer is capable of essentially supporting itself because it's lost a lot of its muscular contractions. Looking at from the side here, the respiratory diaphragm would be give or take right here. And what it's supposed to be doing is taking this viscera, loading it, but it's not able to do that anymore. It's not able to resist effectively. It's not able to pressurize effectively. And so the spine tends to go into this bowed position. Now the thing about this is, it's not all at once. Do understand this rather complex looking and very messy picture is a slow, gradual process. A little bit of rotation, a little bit of side bending, a little bit of rib change, a little bit of loss of diaphragm motion, lack of pressure, change in posture, all slowly building on top of itself. And to add to that, of course, we need the full base of support from the pelvis too. But that's another story.